Hi, my name is Dr. Scruggs, and in this video we're going to talk about Styes and Chalazions. Styes and Chalazions can be a very frustrating problem that many patients experience. Usually it's due to a plugged gland in the eyelid that fills with a pus-type material. Sometimes if these don't resolve, then they will form what are called chalazions, which are a firm ball of inflammatory type material that usually don't go away on their own. With styes, normally we'll treat them with hot compresses and sometimes oral and topical antibiotics, and they'll usually resolve within about 2 to 3 weeks. After 3 weeks, if they haven't resolved, then they usually require some form of intervention. Depending upon the size or characteristics of it, sometimes we'll inject steroid into the lesion to get it to go away, and then at other times it requires surgical drainage. To drain the lesions, we have to numb you up with lidocaine, which can be a pretty significant pinch and a burn on the front and the back side of the eyelid, and then we make a small incision and remove all of the material with the chalazion. Afterwards, you can anticipate having some swelling and bruising. We'll usually give you an ointment to use and have you do some ice to the eyelid. Then after about a week or two, it should be pretty well healed up. We usually see you back in the office at about 1 to 2 weeks, and then again at about a month or so to assure that it is completely resolved and you aren't getting new ones. Patients will frequently get multiple styes and chalazions, and they may have never had them in their entire life, and then all of a sudden they'll get several. This is a very frustrating problem for patients, and unfortunately there's not a great solution. Usually it involves doing hot compresses and trying to get them to drain on their own, and if we can't, like we discussed, surgically draining them or injecting steroids. If patients continue to get them over a long period of time, often we'll put them on a medication called doxycycline. Doxycycline is an oral antibiotic that doesn't really help so much because of its antibiotic properties, but with the anti-inflammatory properties, it helps keep the glands open and helps prevent you from getting future styes and chalazions. Unfortunately, it's not the greatest treatment for one when you've got an active stye or chalazion, but it can help prevent you from getting them in the future, and is something that we may use if necessary. Thank you for choosing Central Florida Eye Specialists, and we look forward to taking care of you.